during this minute, I want to read you an article that I pulled offline, very interesting. So it says a recent study published in Nature Mental Health has identified a potential link between prenatal exposure to acetaminophen, a common over-the-counter pain reliever, as if we didn't know that, you know, and an increased risk of attention ADHD in kids. Researchers analyzed blood samples from 307 pregnant women and found that children born to mothers with detectable acetaminophen levels were more likely to be diagnosed with ADHD compared to those whose mothers did not use medication. Notably, the study observed that daughters of mothers who used acetaminophen during pregnancy were 6 times more likely to develop ADHD, while the effect was less pronounced in sons. Hi, good to see you. You know, if you want to, Carmen will probably pull you out of a chair if you want to come around front. So the reason I'm reading that article tonight, and that has nothing really to do with this talk, is because that's kind of how our society thinks. We think in terms of pain, drugs. Pain, drugs. We're taught to think. Anybody hear on the radio recently the commercials for the Ozempic? They treat it like it's M&Ms. Like, you know, you just call in and you can get it. It's easy to get. And in May, I'm going to do a talk called Talking Back to Ozempic. We're going to really do a deep dive into that and into weight loss and find out what that drug does and why it's so bad. But the reason I'm saying all this is because people don't even consider that posture might be a pretty big issue when it comes to health. We always think in terms of pharmaceuticals and pain. That's how we're taught to think. So I've titled this talk, Posture and Neurology. Posture has a great deal to do with how our nervous system functions. So what we're going to do tonight is we're going to review what we know about posture and why it's important. We're going to show you how to assess posture and practice what we know to share it with our clients and patients. So how many of you know that structure determines function? So which wheel is going to roll better? Okay, yeah, I know it's a dumb question, okay? But structure, the structure of an object determines its function. You take a wheel off a car, and that car isn't going to work. You change its structure, it won't work. You change human structure, you change its function. So in the health world, there's normals, okay? What's a normal for body temperature?
98.6.
98.6. So what if somebody has a body temperature of 96.6? That's just their normal body temperature. What does that indicate? Anybody? Low body temperature all the time. What?
Poor blood flow.
You're grasping, but you're close. It's thyroid. Thyroid issues. Constant low body temperature, you got low thyroid, okay? So we have normal for high blood pressure. What's normal blood pressure considered?
110 over something.
What?
70, 110 over 60 something.
That'd be actually a little low.
Yeah, 20 over 80.
What?
120 over 80.
120 over 80, okay. I mean, that's what you should have when you're 16. Now, if you're 65, you know, you might go up just a little bit, but that's what we consider normal. Those are normals for blood pressure. So when you go into the doctor's office, medical doctor's office, what's the first thing he does?
Blood pressure.
Checks your blood pressure. Has he ever said, hey, I need to look at your posture? Ever? One time? Never. Okay? But we have normals for posture as well. So these are published normals and the first one was published in 1996 for cervical spine, for the lumbar spine 1998, and for the thoracic spine 2003. Surgeons use a cervical spine model to do their fusions, okay? They use that model. These models were published by a chiropractor. By the way, it is PhD in mathematics, so he's a mathematician. So he did mathematical modeling to look at what a spine is supposed to look like. And these are now considered norms in all healthcare. So an abnormal spine or a normal spine is a healthy central nervous system. Abnormal spine, unhealthy central nervous system. So this is what a spine is supposed to look like. This is not normal right here. What is abnormal about that spine? Anybody want to take a shot at it? What's not normal about that?
Too much of a curve, isn't it?
Where?
Like right between the shoulder blades there?
Very good. Very good, Mike. It's a kyphotic spine. It's like, that's not normal. Look at the head care. The head's way out here. That's not how a spine's supposed to look. So the central nervous system controls the body. Would everybody agree with that? That our central nervous system controls our body? Okay. Anybody not agree with that? Anybody think something else controls the body? No, okay, good. Yeah, you cut the head off, what happens? People die instantaneously, okay? You cut off the brain from the rest of the body, you can't live like that. So the spine protects and informs the central nervous system. So when I work on you, and we're working on your spine, we're working on the central nervous system through your spine. We're actually central nervous system doctors. That's really, in many ways, what we're working on. Now, we work on bone and joints? Sure we do. We use that to inform the central nervous system and how it's supposed to act. So posture is really a window to access brain function. So there's different postures right here. You've probably seen a lot of those. How is abnormal posture unhealthy? So do you think that somebody like this, do you think it takes more energy to walk like that? Like, you know, anybody ever had a problem where you walk? It takes a lot of energy to walk like that, okay? So the more your posture is off, the more energy your body's going to consume just maintaining function. So eventually this will lead to some sort of sickness and disease. So here's an article out of Psychology Today in 2020. It's interesting. It says abnormal posture, you're less attractive. Body language cues that increase physical attraction. And here's a quote from that. Body orientation and openness. It's no secret that a closed off body posture appears uninviting and can say, I'm not interested. Facing the other person invites a connection. An open posture conveys trust and makes it easier to be approached. So, abnormal posture, you have more pain. So I want everybody to do this. Hold your finger out like this, okay? Curl it, do this, okay? A normal neck is curved like this and it supports your head like this. Now, take your finger and bend it back like this. You see the difference? Okay, that's an abnormal neck. That's a reversed cervical curve. So you have a reverse cervical curve. Now bend it back like this again, okay? The spinal cord is supposed to follow the curves of the spine, just like that. So what do you think happens to the spinal cord when you bend it back like this? I would say probably 40% of the people who come into me have a reverse cervical curve. What do you think happens to the spinal cord? It stretches it, okay? It stretches it, and it's not designed for that. So when you have a bad neck, it's more than just bones and joints. It's what it's doing to the central nervous system. Now, I want you to do this. I want you to put your shoulders back, sit straight. Okay, take a deep breath. And let it out. Now, was that fairly easy to do? Now slouch down like this. Now take a deep breath. Out. Not as easy. So posture will affect breathing and function, okay? So the average pain-free person above 45 years old tends to lose about a half a square centimeter of gray matter in their brain per year. The average chronic pain patient can lose as much as 10 to 20 square centimeters of a posture where you're leaning to one side a lot or you're pulling your whole body forward, the nerves that come out of your spine don't transmit messages to the organs nearly as well. But here's the other thing. If you have bad posture and you're slouching all the time, what does that do to your organs? Squeezes them together, okay? They can't work as well, all right? They can't function as well when they're squeezed together, all right? So abnormal posture, here's another interesting study. You're less coordinated and balanced. So they looked at people with forward head posture, like this, where the head's out like this, okay? And they looked at their ability to track with their eyes. Guess what? They didn't have nearly as good hand-eye coordination. Now, I've always thought, and I said this, you've heard me say this, they ought to let the NFL know that. You know, those people ought to have their posture checked. And a lot of them do. There's a whole bunch of NFL players that go to chiropractors. I think about half the NFL teams have a chiropractor on staff. There's another thing, they can't return their head to neutral as well, and they're off balanced more. So if you have abnormal posture in your head, you constantly have this anterior head carriage, you're more likely to have problems with balance, movement, and falling. How many people do you see like that walking around? I notice it all the time. You know, they're up, heads out there like this, you know, or they have this kyphotic posture, and you know, they're shuffling along. That's not good for people, okay? And I just wonder how many, you know, those are people that really need structural neurological care, and I don't know how many people are getting it. Abnormal posture, how does it affect your autonomic nervous system? So who can tell me what the autonomic nervous system is? Come on, some of you have been in my talks for a while. You gotta know that, okay? Nobody knows what it is?
It's either automatic or unautomatic.
What?
It's either automatic or a non-automatic movement.
Okay, so it's your autonomic, that's pretty close, okay? Your autonomic nervous system is a part of your nervous system that controls body functions that you don't think about. So how many think about your gallbladder squirting bile into your small intestine? And you don't think about that, okay? You don't think about your heart beating. You don't think about all the hundreds of functions that the liver does. But the autonomic nervous system controls all that. You have two parts to your autonomic nervous system, sympathetic and parasympathetic. Does anybody know what the sympathetic nervous system does? Nobody knows? Okay. Anybody almost been in a car accident at one time? Or you just missed being in a car accident? How'd you feel? What happened? Feel your body tense up, things in your body just change instantaneously. That's your sympathetic nervous system working. When that's engaged, you cannot heal. Your body cannot heal when your sympathetic nervous system is constantly engaged. Your parasympathetic nervous system, how does it feel when it's Thanksgiving Day, your family's over, you smell turkey, you know, football's on TV, everybody's happy and talking. How does that feel? Feels pretty good, right? That's your parasympathetic nervous system engaged then. So what happens is when you have bad posture, especially forward head posture, that's constantly engaging your sympathetic nervous system. That engages that system, that fight-or-flight system. And it's really, really difficult for your body to heal when that's engaged. And so getting adjusted, and that's why I'm constantly on my patients about, you know, are you doing your neck traction exercises? You know, people get tired of me asking, you know, and it's because I'm trying to pull your head back so it's not forward, so it's not stressing out your nervous system, your central nervous system. So abnormal posture breaks down your spine faster. A kyphotic neck, which is a reversed curve of the neck, breaks down in terms of osteoarthritis 200 to 300 times faster than a normal neck, okay? So that's why, you know, I put everybody with the kyphotic neck gets Denerol, and I tell them to lay on it because I'm trying to get that curve back into their neck. And it takes time to do that. Bone is living tissue. It responds to stress. So When you stress a bone out you stress your neck out by putting the head forward, that literally breaks down the joints in your neck over time. So here's an example. If you have good posture, your head's sitting straight on your shoulders, your head weighs about 11, 12 pounds, okay? If your posture, if you have 30% curve in your neck forward, now your head is producing 18 kilograms, or about 38 pounds on your neck. A 45-degree curve, it just keeps going up and up. And your body, your neck and your spine isn't designed to handle that type of weight. So this is an interesting study. This is one of the best studied chiropractic studies I've ever seen. A study published in the journal Scientific Reports, by the way, which is one of the hardest journals to get published in. This was in 2022, showed that a loss of normal cervical curve slows down the processing time, conduction from brain to the body in an asymptomatic population. So what they did is they took people that had no symptoms and they measured the speed, and they took people that had reversed curves in their neck and loss of curve. And they measured the speed of what it took from nervous energy or nerve signals from the brain to the body. And you can measure that. We have the equipment to do that. And then they put them on a Denerol and put the curve back into their neck and then measured it. And what it showed is that when you put the curve back into somebody's neck, that really changes the speed of the brain, of the messages from the brain to the body. Otherwise, you're getting static in there, okay? This is a very, very powerful study. And first time that study had ever been done. So here's another thing that I want you to understand, is that the messages from the central nervous system to the body aren't just neurochemical. We think of them in terms of neurotransmitters like dopamine, serotonin, acetylcholine, gamma-aminobutyric acid, those things are important. But these messages are propagated like sonar waves. Okay, so it's not just neurochemical. It's like sonar. And when you take the spinal cord and you make it taut by changing the curves in your spine, what happens is these messages get garbled. They don't get there like they should. Okay, so again, very important to understand what posture does. Now, what about posture and blood flow to the brain? This is another great study done by a chiropractor out in Boulder, Colorado, at the University of Colorado. So on the side of our neck, we have this this artery that supplies blood to the base of the brain. It's called the vertebral artery. Okay, so when you have curve in your neck, that artery, like the spinal cord, follows the curve in your neck. And what Evan Katz was the one who did this study. And what he found out, and they looked at 9 people, they put them through a functional MRI, and they looked at how does blood flow to the brain change when you change the curve in the neck? How does that change? And you know what they found out? They found out when you lose a curve in the neck, and it slows blood flow to the brain. And when you put the curve back in, the blood flow increases immediately. In fact, I heard him interviewed once, the guy that did this study, and he said the technician that was running the MRI was really surprised at what they found, that when you correct the loss of cervical lordosis, the cervical artery pumps more blood, you get more blood to the brain. So you lose blood flow to the brain when your neck isn't right, and you lose wave propagation from the brain to the body. So what else happens with loss of cervical curve and altered head posture? And this is in the Journal of Clinical Medicine a couple of years ago. So head and neck alignment play a role in whole body pain and impairment, including lower back pain and related disorders. What that means is that when you have forward head posture, it puts a lot of stress on your lower back And that a lot of people lower back pain have that because of forward head posture. Abnormal cervical posture increases the stress and strain in the entire spinal cord and nerve roots. Loss of cervical curve contributes substantially to lower back pain. And correction of abnormal cervical posture using chiropractic and the Denerol will correct all of the above. So what are the problems with kyphotic posture? So people that have this kyphotic thoracic spine, there's some studies that have been done, and they show that the worse it is, it's really associated with loss of independence and mortality. So I don't know about you, but as I get older, I do not want to lose my independence, okay? Really, is anybody? Nobody does, okay? My mother is 94, and she's still pretty independent, okay? And she's gone to chiropractor, I don't know, the last 60 years. And she's still pretty independent. I mean, she's kind of going downhill a little bit, but who wouldn't at 94, you know? But she still lives in her house, still cooks her own meals, still watches Fox News. She watches the NFL during football season, you know, and she's still pretty good, okay? But she's paid a lot of attention to this over the years. Now, the deleterious effects of kyphotic posture on health, a decline in physical function, it changes your ability to breathe, increased pain, it causes GERD and poor quality of life, and it increases falls. So when you have this kyphotic posture like this, and you walk like this, the whole center of gravity of your body is out in front of you, so you're going to fall easier. How does technology affect our spines? And this has actually become a medical term, text neck. Okay, so here's an interesting study. This is the International Journal of Environmental Research and Public Health in 2021. It's a direct quote from this. The improper use of personal computers, especially cell phones, might be related to the development of a complex cluster of clinical symptoms, commonly defined as text neck syndrome. Children and adolescents spend several hours a day on their smartphones and handheld devices with their heads flexed forward to text and read. What do you think is happening to their neck, the curve in their neck? Anybody? Yeah, not good. Not good at all, okay? We're creating a whole generation of kids who are losing the curve and changing the curves in their spine. The text neck syndrome has increased stresses on the cervical spine. This is out of the same journal article, which can lead to cervical degeneration along with other developmental, medical, psychological, and social complications. Complications can involve the eyes, the heart, the lungs, the head, and the mental health field. These postures result in long-term damage to the body, including taking years off their life expectancy. So I'm not saying that kids should never use a phone or an iPad or anything like that, but I am saying this, is it needs to be monitored, and I think it'd be really good to make sure that the child does something to counteract what he's doing to his neck. So what's one simple thing they could do? Anybody? Think about it. What could a child who looks down a lot, what could you have them do that would counteract that effect?
Use it straight ahead instead of looking down.
That would help, okay? Definitely, that's a good idea. You could have them lay in their bed and just hang their head off the side of the bed. Just hang it, you know? Put that curve back into the neck, okay? Let them hang their head, do it for 20 minutes, okay? That's a simple, easy, doesn't cost anything solution to that problem, okay? So here's a study that shows that if you had a diagnosis of low back pain in the previous year, is correlated with an 11% increase in mortality in the current year. Getting adjusted and correcting your posture actually changes your genes. It repairs your DNA. We have good evidence of that. We have studies that show that, okay? Here's another study. This is out of the Journal of the American Medical Directors Association. Poor gait performance predicts dementia. Poor gait performance is a strong predictor of non-Alzheimer's dementia. So when you assess posture, it's like taking blood pressure. So you take somebody's blood pressure and you say it's low, it's normal, or maybe elevated, okay? So when we have somebody screened for posture, I do the same thing. Now, just about everybody here, I've screened your posture, right? What's the first thing you do? I do when you come into me. I talk to you, we go in the exam room, what do? First thing I do is I look at your posture, okay? And I tell you what I'm finding, all right? So it's one of the first steps in looking at somebody's neurology and their central nervous system is looking at what's their posture doing. So let me tell you how to do it, okay? So when you examine somebody's posture, when you're going to look at them, you always start from the feet and you go up. You start from the front and the back, and then you look at the sides. So if somebody is just standing there and one foot's out like that, do you think that might mean something? Okay, yeah. You know, I have a next door neighbor and I really like the guy, but he walks like this and he runs like that. His feet are out like this, and I'm going, how much more energy does it take for him to do that? You know, I mean, that would take twice as much energy to walk like that. So you look at the feet, then you look at the hips. Are the hips level? Are the shoulders level? Are the ears level? Okay? And you look for balances. Now, you go home and you know, look at your spouse's posture. I'm sure they'll enjoy that. Okay? And then you look from the side. Like, what does their head look like? How is their head positioned on their shoulders? And what is do they have a kyphosis where they're sitting like this? So let's say you examine somebody's posture and they've got a forward head carriage and they've got a bit of a kyphosis. Okay, so what could you do at home that would help that? What are some of the things you could do just on your own? Now, you should come in and let me look at it, but let's say you just want to do something at home. What is something you could do that would be low cost, low tech that you could do? Anybody?
Your head over the mattress scenario. Do that.
Yeah, you could do that. You could start there. That's a good idea.
Get a pillow, one of them firm pillows. What do you call it? Denerol.
Yeah. You have to get one of those from me, okay, which would be fine. What else could you do? Let's say you don't know about a Denerol. So what could you do? Anybody?
Stretches.
Okay, you're getting warm. Okay, stretches. Okay, what kind? So if somebody's like this, you want to do the opposite, right? You want to bring them like this. Okay, so you take a big Swiss ball, you know, the kind that Carmen sits on back there, and have them get one of those and just lay on it like this. Okay, just have them lay on it like this for 10, 20 minutes a day. That would bring their head back and it would shove the kyphosis forward. Okay, so you could start doing something like that. Anybody in here ever hear of the Superman exercise? Do you know what it is? Okay, I do it at home. So you lay face down. I do it outside on my deck. So my head's over a step. Put your arms out like this, legs are out, and then you pull your legs up and your arms up and your head up, so your body's in this shape here. It's an extension, actually, and you just hold it like that. And you may not be able to hold it for more than a couple of seconds at first, but after a while, you'll be able to hold it for a long time. So you can do that, the Superman exercise. So there's low-tech things you can do at home that would help this, all right? And so that's something that I would recommend. Now, if you have a kyphotic neck, you definitely want to use a Denerol and get that, try and get the curve back in there. And some people have abnormalities in their neck where they cannot, necessarily get a full curve back in, or it's not all going to come in all the way. And some people are just born like that, but you need to do the best you can. But you can start out with something really low tech. Just use a Swiss ball and lay on it. I do that at home a lot, actually. It's one of my workout routines. So there are things that you can do to help yourself. But what I would recommend is you at least get your posture checked. Get it checked. Have someone check it. I'll check it. I mean, we do that in our clinic at our expense. If you come in as a new patient, one of the first things we do is check your posture. We tell you, hey, this is what's going on. So does anybody have any questions about anything I've gone over? Here's lots of questions tonight. Okay. So who do you know? Think about this. Who do you know that is suffering from pain, has bad posture? You know that they do, and they need help. Think about it. Think about a name that comes to mind. You could call my office. I'd be happy to screen them. We do it at our expense. We look at their posture. We look at their leg length. Do a range of motion of their neck. We'll palpate their spine. And that takes about 10 minutes to do that. I will tell them what we found. And if they've got postural issues, we'll let them know. And let them know what they can do to help those issues. Now, sometimes, if you have enough arthritis in your spine, sometimes your posture isn't going to change as much. But it can change some. And especially when you're young, like you, you change your posture a lot easier. So I would recommend, if most of you know somebody like that, tell them about it. Tell them about this talk. I'll send you the slides if you want. You can show your neighbors. Okay. And start screening people. Practice. Look at people's posture. It's not that hard to do. You don't have to go through 4 years of chiropractic college to evaluate somebody's posture. Just look at them. Look at their ears. Is their head on straight, or is their head way over to the side, translated like this? So what do you think that kind of pressure puts on the spine? Watch. I saw this newscaster on TV not too long ago. I looked at her. I just was looking at her posture, and anytime she'd get relaxed, she'd do this. I thought, man, that woman has got a bad head tilt. She needs to get adjusted. Okay. Then she'd start talking straight, and then she'd relax, and then she'd go back to looking like this. And what's that do to the eyes? The eyes aren't level. And if you walk around like that, then your spine eventually will start to curve to level your eyes, and it's one of the ways you get curves in your spine that you don't want. So good. Any other questions? All right, great. So our next talk is on the 25th. I'm going to do that at Turning Point Chiropractic. That's building immunity for health, and we'll do it here eventually as well. And then in May, I don't know if you're interested in the drug Ozempic. I mean, it's just crazy. So I'm going to do a talk in May. It's not on the schedule yet, called Talking Back to Ozempic. And we're going to do a deep dive into that subject. And I'm going to scare everybody so you'll never want to take that. Okay? I'm going to tell you how it was discovered, which is really interesting. Who discovered it, and then what happened afterwards, and what that drug does to the body. And we're going to do that again in May. I'm going to do it at Natural Grocers on I think it's May 18th, it's Saturday. So good. Thank you so much for being here tonight, and hope to see you in the future for another